Our next task in working with the dental module is setting up the practitioner. The practitioner will be registered here. So you would add the healthcare practitioner here. So you edit in the full form. So the first name, the middle name, the last name, the mobile phone, and also the practitioner type. It can be internal or external who's working in a part-time. At his employee profile. So we will create an employee profile for him so that he will be paid under the payroll. So, and also the appointment is means the schedules that he will be working. I will show you how we can create a schedule later. And with the service units, we will also set that one. And also, if he has a Google Calendar, we can integrate his Google Calendar with our calendar so that he will be updated whenever there is an appointment. And also, if he's charging a patient within the item, like if he's charging per visit, so we can also set it up, but I don't think you need that on most cases. And also the accounting details. So whenever there is a payment for this person, we have to create an account for this person in our chart of account. So default account will be sales or service. So we can also make it a service. So when there's a new account, we can also create for this person. But for this person, I recommend creating a new account for this person. So whenever there's a debit or credit for this person, we will call that account. So for example, for our demonstration, we have set it up a practitioner called Dr. Demo. And this practitioner is an internal practitioner who is working full time. His department is medical department. And also his shifts are from day shifts, work days day shift, and his service units are microbiology OPD. And this is how you would set up a healthcare practitioner. With dental clinic, he's setting up the medical departments. So we have our patient, we have our practitioner, and we need to have a place to operate on. So these are an example medical departments. We have urology, serology, pathology. So as your physical uh, practicing warehouse or hospital, you can set up the medical departments. So you don't need to have all these medical departments. You might specialize in some departments, so you would configure the specific department that you are working with. And also, the next task is since we have our patient, our healthcare practitioner, and our department, one thing we need to have is our practitioner schedules. So every healthcare practitioner needs to have a schedule so that it would have a working and non-working hours. To do that, we will set up the practitioner schedule. For this schedule, what we need to have is the schedule name and the time slots. That's all. So, for example, let us see work days, day shift. So for day shift on Sundays, how we are operating on Sundays, from which time or from starting from which time to end. So we need to, for example, if it is a 9 to 5, we can make it 5 p.m. And since it is working on 24-hour manner, so 5 would be uh, around 17. And also, you need to set up the approximate appointment time. So, depending on the medical department, there is a standard time which the practitioner is expected to complete his visit. So, if the appointment takes 50 minutes, okay. If it's 30 minutes, 30, or if it's an hour, we'll make it 60. So, whenever we click add, what the system would do us is he will it will get the time difference between these two hours, and it would divide it to the appointment duration, and it will give us a slots of visits. So if it is 4 hour and the appointment takes 60 minutes, so it will give us 4 slots. So this is how I set it up, 9 to 5 working hour shift. So depending on the medical department, and you might have also an external practitioners who would work in a part-time basis. So you can add the part-time schedule, and also if it is an operatory or, for example, a surgical department, so you can have your own custom-made schedules.